simulation of a healthcare facility going on with patients which are green color and nurses blue color walking around a certain schedule, certain time of the day. They do different activities like dressing, undressing, get you ready for a scan of the full body. We can see here in this simulation that the patient is coming and going away from the facility and he's dressing and undressing without being accompanied or escorted by the nurse. That's a problem because the patient might feel anxious. And this is a problem that only can be detected if you consider time and the space plan. Therefore, we do a 4D simulation, which means 3D of the space plus time, which is the fourth dimension. How do you know where the nurse and the patient will be in the facility? For that, you also need something else before the simulation. So you need to make sure that the data which is in here is valid according to the user perspective. The user of the building needs to put the data himself. For that matter, we have designed first a low-tech tool where all the users of this facility, they came and they draw where they would walk, the technician that will maintain the facility, the machines, the nurse, here the patient. It turns out that this tool was not enough because they wanted to change also the space, also the facility itself, once they realized that it was too busy, this area, for instance. But this could not be done using low-tech. Therefore, we came back to the computer. With the computer, we can draw the paths and we can also change the space. For instance, I have an example here. This is the floor plan, the spatial plan of this building here, where we are right now. And this is a conference where Technology Fair 3TU 2013. And I asked people who came here, so let's show what they did. I asked them, please walk, where have you been? And then some people could not tell where they were. Where did they walk? I don't know. The problem is that this is a 2D representation of a space, which some people cannot visualize and relate to their own position. Therefore, we need 3D. When I asked the same question again, using this 3D version, which is the same map, people could relate and say, oh, I am here. And then they could draw all these maps. But coming back to the 2D, how does it work? It's quite easy. So you just press a button here, or actually don't press any button, you press the real screen, and then you show that you go here, and then you go there, then you remember that you went to the toilet here. And then after you do all these paths, then you can see them reflected in 3D, and you can think, whoa, everybody, after you collected all this data, everybody's going through this corridor, right? So there's something wrong. Maybe this corridor is too narrow. Maybe we need to make this corridor a bit broader. Then what you do, you just change it, the space, you just change it, and you see the results happening in real time. So now you see an iterative approach for designing facilities, which is based on input from user data, and is progressive and helps you to improve your design and not only to find faults as we saw at the very beginning. That's in a nutshell what consists this research on walking paths optimization while you design new healthcare facilities.
I should stop.